Hey, good afternoon. Welcome, everybody here in person, as well as those joining us via Zoom. We are in for a real treat today. I've attended several of Dr. Roy's lectures, and I'm just going to say fasten your seatbelts. You are going to have a wonderful and very informative time today. This program is just another example of the multi-year legacy of cooperation between the City of Evanston, which owns and operates the building and pays the staff and supplies a core of programming, in collaboration with the Levy Senior Center Foundation, which relies on volunteers and donations, but they're both united in a mission to help improve the quality of life for us seniors here in the Evanston area. So I'm very thankful and proud to be a member of the organization. Dr. Roy is eminently qualified to speak to us today on the topic of staying sharp, which means brain health. She is trained in traditional medicine, receiving an MD degree and then internal medicine residency certification, but that wasn't enough. That didn't quite satisfy her desire for knowledge. She completed a 2-year fellowship program in alternative and integrative medicine, which I'm very happy as a physician to see this becoming more and more a part of medical care. That alternative and integrative medicine is a gateway to include the wisdom and the techniques from the Eastern cultures. So we're very, very blessed to have her in the community where she works out of her office in Glenview. But to have her here today is just a real treat. A couple of housekeeping matters. I've been to several lectures now by Dr. Roy, and I'm going to say fasten your seatbelts. She will certainly cover no less than 100 separate topics. And so thinking to myself as a member of the audience, well, which 1, 2, or 3 things am I really going to take home and integrate into my life? And so I hope you have cards and you'll be thinking about taking notes or remembering to watch again on, as this is replayed on Zoom, to find those out of all the available options, those that seem most relevant and harmonious to your perspective and your needs. We are going to have this program recorded on Zoom, which means for the consideration of those who are watching from home, holding questions until the end, and then using the microphone. And that way things are recorded clearly for other listeners. Is there anything else that I might have forgotten by way of introduction? Then I will ask for a warm Levy Senior Center welcome to Dr. Debjani Roy.
All right, thank you so much for the introduction and welcome everyone, in spite of this very cold weather again, but it looks really sunny outside, so thank you for joining us. I'm going to go through 2 topics today, and if you have any issues hearing, let us know. We're just trying this microphone on today, so let us know if you're having any issues hearing. So I'm going to be talking about, the talk is going to be 2 parts. The first one is going to be about balance, and the second one is going to be about healthy mind. And both of them are pretty related, as you will see as I go through the talk. I do have several questions already submitted, and I try to incorporate them in my slides, but I will go through those questions after the talk, and then we'll open it up to you for any other questions. So our agenda today, I'm going to discuss a little bit about what balance is, and then we're just going to discuss about physical activity and some protein requirements and diet as we age. And then we'll go on to discuss cognitive health and about the special diet called Mayan diet. So balance, it is our ability to distribute our weight in a way that lets us stand or recover if we do lose balance or trip or fall. It requires coordination of several parts of our body. The central nervous system, the brain, our eyes, our ears, our joints, ligaments, tendons, and also our nerves. So, and any issues with these as we age can affect our balance. And as I think a lot of people know, the cause of falls is one of the #1 issues for ER visits. And then it sets off the cycle where if you do lose balance and if you have a fall and we feel that, we should not be moving anymore, and that makes us even more weaker. So it sets up this cycle, a really bad cycle of weakness and muscle loss. So as I mentioned, so these are some of the causes of loss of balance. And as you can see, our hearing, our vision, our muscles, joints, tendons, some of the diseases of the nervous system, and definitely medications affect our balance. So with our ear, if we have what we call is benign positional vertigo, so that's when we have some dizziness or lightheadedness when we change our position, whether we are standing up from a laying down position, or if we are moving in a certain way, and that may cause some loss of balance, and it's related to our ears. There are some small calcium particles in our inner ear, and if they move out of place, it can cause the sense of dizziness. And then the other ear diseases are labyrinthitis and Meniere's disease, sometimes associated with hearing loss, ringing in the ears. So if you do have those symptoms, it's a good idea to get tested. And then the vision issues, diabetic retinopathy, cataracts, glaucoma, macular degeneration, all affect our vision. And it's just the whole central nervous system is connected when we try to move. So taking care of our vision, our hearing is very important. And then, of course, as everyone knows, arthritis, it's wear and tear as we grow and older, sets in, a lot of pain and a sense of loss of balance. Peripheral neuropathy, and this could be caused by several pathology or disease processes. Diabetes is one. Certain medications, undergoing chemotherapy can cause a lot of issues with our nerves. Certain diseases of our nervous system, such as Parkinsonism, dementia, multiple sclerosis, also affect our gait. And then this can cause loss of balance. And medications, I'm going to come in detail about certain medications which can cause dizziness, vertigo, and subsequently loss of balance. So first, I'm going to discuss about some physical activities which can help you with balance. Next slide. So I want to distinguish, because a lot of our patients come and tell me that they're very active throughout the day, they do a lot of work. But I want to make that distinction between physical activity and exercise. So physical activity refers to any activity which moves the skeletal muscles of our body, that is the muscles in our arms, our legs, back. Exercise refers to a structured and repetitive physical activity with a specific intent, which is to be more conditioned, increase our cardiorespiratory function, so our heart and lung function. So it's very structured and restrictive. So it pretty much focuses on, on our endurance. So it's not just, maybe just walking around in the house and, vacuuming or gardening, which is great. But exercise is very specifically structured. So that's the real distinction I wanted to make. And then physical fitness, as we grow older, refers to development of specific skills. The main ones are your muscle strength, flexibility, balance, and also your agility, how quickly you react. So these are some really good issues, and our exercise and our physical activity will help us improve our physical fitness. So as some of the benefits of exercise, like I think all of us know, it lowers our risk of dementia. So when you walk, even walk, it increases our blood circulation from head to toe. So it lowers the risk of dementia and improves our ability to do all our activities of daily living, which is taking care of your health, cooking, doing your like laundry, dressing yourself. So the very basic activities of daily living. It decreases the symptoms of depression and anxiety. It does release certain chemicals which actually make us feel a little more happy, so we get more motivated. Helps with our sleep, reduces pain. So the more you move, the better your pain is, because moving, and it's sort of like stretching, or even when doing massage or acupuncture, it releases certain chemicals which are similar to our endogenous, we call, so our own opioids. So these chemicals help with decreasing pain. So the more you stretch and move, the less will be your pain. And it also improves certain chronic health problems, especially like diabetes, helps bring down the sugar, your cholesterol, your blood pressure. So it's really helpful for all these chronic health issues. And that results in increased lifespan. So I wanted to discuss two types of exercise, two main types of exercise. One which we call aerobic exercise, and the second one is called resistance or strength training. Aerobic exercise refers to activities which will stimulate your heart and lungs and improves your cardiorespiratory fitness, as we call it. And in doing so, it improves our ability to utilize the oxygen when we breathe. And I'm going to go through some examples. So the Heart Association, they recommend at least 30 minutes of daily aerobic exercise per week. Actually 2.5 hours per week. So you can spread it out over 1 week. Or if you're unable to, you could also do more exercise certain days, but at least 2.5 hours of aerobic exercise per week. And then the strength training and resistant exercises increases our flexibility, muscle mass, and our body fat composition. And I will come over the examples. So again, it's recommended at least 2 days of resistance or strength training per week. Next slide. So these are some of the examples, and there's many more. But some of the common ones, aerobic exercises, walking, dancing, swimming, cycling, jogging. So they all increase our utilization of oxygen. And then we have the resistance training. So these are like free weights, resistance bands, push-ups, squats, and calisthenics. So these will help form our muscle mass, especially in patients who have osteoporosis. This is really a good way to increase your muscle mass and protect your bones. And I just wanted to discuss some of the mindful movements. These could be a combination of both aerobic and resistance, but these also help with mindfulness and helps with our anxiety and focusing. These are yoga, which is done in a mat like in the picture. And then Tai Chi. Tai Chi is really good for balance. It's a little less stressful than some of the yoga postures, but it does, both yoga and Tai Chi, they incorporate a lot of breathing in and out. So it helps not only with balance, with muscle mass, but it also helps with mindfulness. And then Qigong, Pilates, and walking, we mentioned, is also a mindfulness-based exercise. Okay, and then I just wanted to add, so all the exercise, we have to, it's not going to be the same for everyone. It will depend on your ability to exercise, how much you can, your strengths, your other medical issues. So always discuss with your doctor, and they can give you what is called a fit prescription. So it's basically guides you as to what type of exercise, how long, how much, and this would have to be personalized. It's not the same for everyone. So you don't want to exercise to the point where you're going to injure yourself. So all your risks and your medical condition needs to be taken into account. I'm going to come to some dietary protein requirements. In the past talks, I've discussed a lot about diets, but as we age, our protein requirements change, and it's very essential for our muscle mass so we don't get weaker and lose our balance and fall. So this is our protein requirement as we grow older. We need about 1 to 1.6 grams per kilogram of our ideal body weight per day of protein, which is a lot. Usually in normal adults, it would be about 0.8. So we need at least double. And this is because of our muscle loss as we age. And it helps stimulate our protein synthesis, muscle protein synthesis, and greater muscle strength and function, and prevents sarcopenia, which is breakdown of the muscle. So this protein could be animal or plant-based, and I'm going to go into details about it. But this is the requirement per day, and it can be divided throughout your meals, whether it's breakfast, lunch, dinner. So it's a good thing to incorporate some amount of protein with every meal. It's very essential, and that way you can distribute your total protein requirement. So I'm going to go discuss some plant-based protein and some animal-based proteins that you can add to your diet. So the main plant sources are legumes, beans, nuts, whole grains. And some of the examples for legumes are the lentils, the beans, chickpeas, peas. Peas have a very high amount of protein. It's one of the highest protein foods if you're plant-based. And then edamame, soybeans, peanuts, under nuts, seeds. So almonds, walnuts, pistachio, and then cashews, pumpkin seeds, sunflower seeds, flax seeds, sesame seeds, chia seeds. They also have this benefit as they have a lot of omega-3s, especially the seeds. So that's good for your inflammation, for your heart. So these are good things to add. And then whole grains, wheat, quinoa, rice, oats, buckwheat, millet. So these are all really good whole grains to add, and they all have protein. And then other options would be all the vegetables and fruits. They all contain some amount of protein. But the beans and the legumes, the nuts have a really good source of protein if you're plant-based. And they say that just a handful of nuts every day should help with all the good oils and your protein. You can add it to your salad, you can add it to your granola, or you add it to your like yogurt. So that's a good. And then animal-based proteins, there's several options. Poultry, Seafoods, especially fish, eggs, are good sources. Dairy, such as yogurt, milk, and cheese, we usually recommend in moderation, especially if it's dairy, and especially if it's red meat or processed foods, as they have some other risk factors associated with them. And there is a way your doctors can calculate how much of protein you might need based on your weight, on your ideal body weight, and they can help you, or either your doctor, your nutritionist can help you calculate how much you need and what would be the sources of protein and come up with a plan so that it can be personalized to you. And I wanted to talk a little bit about protein powders. It's so common. And then if you're not getting enough protein in your normal diet, protein powders would be a good way to supplement the protein you need. And there's several protein powders available. A lot of them are plant-based. So you have whey protein, rice protein, you have pea protein, very high in fiber, a lot of protein. And then so if when you calculate your protein requirement and you see that you're unable to get enough protein through just your diet, then adding a protein powder once or twice a day will help you with your protein intake. And just some of the options for protein powders, like I mentioned, the peas and the rice, whey protein, pumpkin seeds, sunflower seeds, alfalfa also have a lot of protein, and they can be incorporated in powders. So these are not regulated by the FDA, so they're considered as food. So you must check and maybe discuss with your physician or nutritionist what type of protein powder you're getting, especially if you're getting it online, and just make sure they have healthy ingredients, because a lot of them have like vitamin, minerals, some additives. They have like artificial flavorings and sweeteners. So if you have a condition where you cannot take or these additives will harm you, that would be something to look out for. So yeah, talk to your doctor, your nutritionist about it. All right. All right, I'm going to come to discuss about now the second part, which is the healthy mind. And I want to talk about brain health because this is also important in maintaining a balance. So I want to discuss what the different types of brain functions are. And so the brain health or cognitive health refers to how well a person's brains function over several areas. So how well you think, you learn, and remember. And that is cognitive health. And then the motor functions are how well you make and control movements. And this has a lot to do with your balance. An emotional function, how well you interpret and respond to emotion. And then we have tactile function, is how well you feel and respond to these sensations of, say, heat, pain, temperature, and touch. And then the sensory functions, again, very related to your balance, which is your hearing, your vision, your taste, and how you can smell, if you're able to detect odors. So all of this is important for our brain health. And I want to really emphasize that our physical health is very related to our cognition. Some of the important points to take home is that taking care of your physical health helps with cognitive function. I'm going to explain specifically one issue in the next few slides, but managing all your chronic health issues, that is hypertension, diabetes, depression, is important for cognitive health, especially like, for example, with diabetes, if you have peripheral neuropathy, you're not able to feel well and you have more loss of balance and you can fall. And it also causes small strokes. So if your sugar is not well controlled, you can have these small strokes. It can block your arteries, causing more cardiovascular issues. So there's a lot of complications from diabetes. So make sure that your sugar is well controlled, your blood pressure is very well controlled. And then the depression, that also helps, it prevents sometimes, we don't think as clearly if we're depressed. We're kind of trying to figure out, how to maybe comprehend what's going on and how to react. So, and you might not feel like taking care of your health. So it's important to address these issues. And then, like I mentioned, some of the sensory conditions like your hearing, your vision. So when you walk, when you take a step, you want to see where you're going, especially it's called the depth of vision. A lot of us have changes in our perception of the depth of vision. So it's important to get your eye exams at least once a year, if not more frequently, if you have other condition. And then the hearing too, you tend to focus on where the sounds are coming from, and that kind of guides you with your movement. And then reducing the risk of falls, as I mentioned, especially if you've had, which might be be related to any brain injuries or falls in the past. So limiting the use of alcohol, and that can really cause poor judgment, gait instability, and more falls. And then again, being very mindful about your diet, if it's especially related to certain conditions that you have, such as high blood pressure, high cholesterol, high sugars. And then, of course, getting enough sleep. Sleep is very important. It helps us heal when we get our deep sleep. And I did a talk just with a sleep cycle, but it's very important to get our deep sleep and also the REM sleep, the rapid eye movement. That's when we dream. That it's very important to have both the types of sleep, because it's in the REM sleep that we actually our cognition gets better. Our body has an innate ability to heal. And basically, it helps us release all the previous unneeded memories and makes room for our new memories and new information. I wanted to really talk about hypertension because this is so important for our cognition. And I wanted to discuss the study. It's called the Sprint Mind Study. And it showed that people who are over 50 years of age or even older, and if they lowered their systolic blood pressure, systolic is the top reading, to less than 120 millimeter of mercury, they reduced their risk of developing mild cognitive impairment, which is usually a precursor of dementia. So if you're having any issues with forgetfulness or brain fog, or you should definitely discuss that with your doctor. So they can do a test in the office. And if it's really bad, then they can send you to a neurologist. But controlling the blood pressure is very important, because this high blood pressure can cause even these small mini strokes, which can, later on cause, worsening or bigger or larger strokes. So it's really important to control your blood pressure. And it's recommended, like I mentioned, getting screened for your high blood pressure at your doctor's visit, and managing it with diet, with exercise and medication as needed. It's really important. Okay, I'm going to talk a little bit about this mind diet. This is one of our evolving diets. A lot of research is being done. So it is a combination between a Mediterranean diet, which is the anti-inflammatory diet, and the DASH diet, which is for hypertension. So it merges some of the key features. So it stands for Mediterranean Dash Intervention for Neurodegenerative Delay. And it aims to protect your brain health. It's very similar to the other diet, but it mainly features more on leafy greens. And you can also have other vegetables, but mainly focuses on leafy greens. And the fruits it prefers really berries. So blueberries, blackberries, raspberries, strawberries, all the berries. So they lay more stress on berries. They're very high antioxidants. So they reduce what we call our oxidative stress. This is all from inflammation. So all these berries really help with that. And then it endorses whole grains, beans, nuts. And the easy part of it is, unlike the Mediterranean diet, the Mediterranean diet usually suggests 3 to 5 servings of oily fish per week, while this one suggests even 1 or 2 servings a week would be good for you. It has all the really good anti-inflammatory oils, especially fish like salmon, mackerel, herring, anchovies, sardines. Salmon is a good fish to have. And then it limits, like most of the other diets, like red meat, sweets, also cheeses, fast food, and fried foods. This is a study which was done recently, and I wanted to bring this up to show you how this Mayan diet is evolving. So a research team at the University of Cincinnati studied if the Mayan diet is linked to cognitive health or not. So they investigated between differences between males and females and any kind of other gender or racial population. And they drew data from a large ongoing NIH-supported study called REGARDS. The REGARDS stands for Reasons for Geographical and Racial Differences in Stroke. So what they found was adjusting for demographic and other factors, a really close adherence to the Mayan diet was linked to better cognitive health and slower rates of cognitive decline. And it showed that the population, the participants who participated in the study had a 4% reduced risk if they followed the Mayan diet. They also found, interestingly, that there was an 8% lower risk in women than men, and also less decline in African Americans and compared to whites. But this is a very evolving study, and I think there's a lot of research being done, even at Rush, at our close by. So we are hoping that there's going to be more information on this, specifically on this diet. The good thing is it's just a bit more easier to follow than the anti-inflammatory diet. So, it's just some of our organic food is so expensive to buy, but at least having 1 or 2 servings of fish, good fish, would actually help with the cognitive decline. So. And then I wanted to go through some of other studies which were done about physical activity and cognition. So there was an observational study in normal individuals who were late to middle-aged. And it suggested that doing moderate levels of activity was associated with greater glucose metabolism, which reduced the risk for Alzheimer's dementia. So again, sugar is, and all our foods have so much of added sugar, but reducing the sugar content and watching and being mindful about what you eat helps with dementia. It helps with cancer, it helps with dementia, all our chronic illnesses. So it's very important to watch how much sugar we are adding, or when you buy your groceries, check the labels for added sugars. The less added sugar, the better. And then there was another randomized control study which showed that exercise increases the size of our brain structure related to memory and learning. And it's called the mesolimbic system. And it has shown that being mindful and exercising does increase this area. So it helps with cognition and memory and less cognitive decline. And these are some of the medications that may interfere with your cognitive health, especially antihistamines, Benadryl, Zyrtec, Allegra. I mean, if you need it for certain conditions, but you should take it just for that short while, till you're better, but not like taking Benadryl for sleep every day for years. So that's the antihistamines. And sleep aids, especially like Ambien or any of those prescriptions, very sedating. It kind of declines our cognition, and a lot of falls and ER visits are due to taking some of these sleep medications. Certain antipsychotics, and you definitely want to discuss with your physician whether you actually need it or not. If you need it, you need the medication, but it's just some things to keep in mind. And muscle relaxants, we take a lot of muscle relaxants for pain. Again, taking them for just the time that you need that medication for is very important, and not just to take it forever, or taking muscle relaxant for sleep is not a good idea. And some of the drugs that treat urinary incontinence, this again has to be personalized to you. If you need the medication, the lowest dose that can help you would be more beneficial. I'm going to discuss some ways to keep your mind engaged, but there's some very simple ways that you can keep your mind active. And I'm going to discuss the cognitive training, but there are simple ways to enhance your cognitive health, and they're not expensive. But things like doing puzzles, doing Sudoku, doing any kind of paintings, or any kind of, visiting a museum and learning about, say, another culture, or learning something new about plants, or anything that interests you. So anything that kind of takes you out of your comfort zone and makes your brain work a little bit more and active is very essential. Visiting maybe other places, or getting to know, I'm going to come to that also, just getting to know and being more social, especially here. It's just wonderful to see all of you here, and it's really important for your cognitive health, connecting with your neighbors, connecting with the people in your community is very, very important. Eating socially is really good. It makes you converse. It exercises your mind because you're thinking how to interact. So these are very simple and easy ways to enhance your cognition. And it has shown that the more social interactions you have, the less incidence of dementia. It's the loneliness and not exerting that extra, your mind is wonderful. It can, it has so much power, but if you just let it just sit and not exercise, or just like your body, if you don't exercise, you're become more weaker. So these are some of the simple ways. And actually learning a new language, sometimes that actually really helps your mind work. So it has shown that cognitive training, and that this can be done through a neurologist's office or neurosciences, they do cognitive training, which is designed to improve specific cognitive skills. And it has shown to have benefits in maintaining your cognitive health. And there's this active trial which tested the effects of cognitive training, especially for memory, reasoning, speed of processing over 10 years, showed that training helped with less decline in cognition. And like I mentioned, staying connected with social activities, especially family, friends, neighbors, through social activities, community programs, supports our cognitive function. And there's this very important trial, it's called the iConnect trial, and the health retirement study. It was funded by the NIA, and I'm going to give you some resources too. That high social engagement, including visiting neighbors or your community members, volunteer work, was associated with better cognitive health. I just want to go over some, and this is, a lot of our patients ask for supplements. So I just wanted to touch briefly on those. So there's a lot of supplements available. Some of them work, some of them don't, but usually B vitamins, especially our B12, our B6, certain minerals like zinc, magnesium, they all help form what is called neurotransmitters in our brain, which are these chemicals which help with our mood, with our brain health. So again, you want to discuss this with your doctor, and there are several other supplements which have certain additives in it or chemicals in it which help with your memory. So, but not all of them work. So discuss these with your physician or your neurologist, and they can definitely help you. I didn't discuss the medications that are available. There are several medications also available, and that would be out of our integrative talk today. But there are options if especially if there is a need for better cognitive health. So that's something you want to discuss with your physicians. So I took these references from the first four that you see up there, but I wanted to specifically point out these last three references. It's Alzheimer's.gov and Alzheimer's Association. There's a number there, and also Alzheimer's Foundation of America. They have a lot of information, and if you want to go into their websites, they have information on how to improve your cognitive health. They have several links and information about, diet, your physical activity. So I would recommend you to definitely go and check these sites out. They're really helpful. Also, the NIH and the National Institute of Aging, NIA, they've done several research, and there's a lot of information in their websites too. It's very easy to read, and there's a lot of you can get a lot of insight into what you might need, because everyone doesn't need the same thing. So you might want to go through it and just pick up a few points on what might help you. All right. Thank you for listening. And I think.
Very good. Wasn't that great? Dr. Roy, thank you so much. You certainly gave us a lot to
Yes, I'm so
think
sorry.
about.
Yeah, there's a
I
lot.
warned some of the people, take some notes, and a lot of talk today about risk factors. So we're worried about this, we're worried about that. I'd like to, if I may say, speaking as a physician, everybody who's here and everybody who's joined us from Zoom has some very positive factors going for them as far as healthy aging. Curious, you're curious people, and you have a spark of initiative. You're here, you tuned in, and believe me, that those factors are always working on your behalf, putting pieces of your puzzle together, and making healthy decisions. So I think that's I did want to say those things. We are so appreciative. So thank you.
Thank you. Actually, I have this. Thank you. Okay, I'm going to, I've received several questions. I'm going to go ahead and address them. I did address some of them on the slides, but there's a few that I think I need to address, and then we'll open it up for any other questions. So the first one is, what are your top preventive as well as restorative tips for maintaining balance? And as we discussed, definitely physical activity, and then making sure your physical health, especially high blood pressure, is well controlled. Diabetes, for neuropathy. So, and then just making sure you get your annual eye exams, your hearing exams, have your annual wellness visits. So if there are any issues, these could be caught early and treated. So that's, I think, the top preventive measures that you can do. And then the second question is, which medication can cause cognitive issues? Like I mentioned, it's mainly the sleep aids, the antihistamines, very big causes of cognitive decline. And there's several other options now, whether even from our integrative medicine point, several other natural botanical supplements that you can use instead of these antihistamines or sleep aids. There's several options available. Please discuss this with your doctors. And then this is a very interesting question. Besides monitoring protein levels relative to kidneys when watching your weight, what else can we do? Yeah, so it's very important. I mentioned in general how much of protein intake should be for on an average, but it will vary whether you have like kidney disease or any other diseases where you can't take that much of protein. So it's very important that you do talk to your nutritionist and figure out exactly how much of protein and what type of protein would be essential for you. It's not the same for everyone. The best way to avoid falling is the fourth question, which again, as I mentioned, making sure all your senses, all your physical health is optimal. And we discussed the protein powders. The fifth question is protein powder good way to add protein? Where can we find simple health recipes? So yeah, so there's several books, and I can send a list, but there is one on anti-inflammatory diet and also healthy eating. It's by Sue Rad, and she has a lot of plant-based protein recipes in that book. But I can send a few more email, yeah. There are several books that we can use. And let's see, there's one question which is actually out of context with this talk, but how to minimize your cortisol levels. And there's several ways, and that would be a talk by itself. But basically, cortisol levels are increased because of stress. And managing your stress, everyone has stresses. It is just the way you manage your stress is important, and that helps reduce your cortisol levels. But the best way is to be active and follow a very healthy anti-inflammatory diet. And there's several other options with supplements, botanicals, that you can bring down your cortisol levels. But that, again, like I mentioned, would be a totally separate discussion. I'm happy to consult or email if you have more questions on it. And then we talked about memory and aging. So how do you know when it's time to see a doctor who specializes in memory? So when you go for your annual visits, your annual Medicare visits or annual exams, they do screen you for memory issues. It's a very simple test they can do in the office. And if that's not okay, then they go into further testing. So when you have your visits, your annual visits, make sure that you do get tested. And we discussed the protein intake and the vision and hearing, how they play in. So yeah, so now we can open it up. So yeah.
Before we open up questions for the room, we do have 2 questions on Zoom. One is, what are some Mind Diet books for us to read?
Mind Diet?
Mind Diet, like if you have a recommendation for any books that you may know of.
Yeah. So like I mentioned in the slide, this can be recommended actually by your nutritionists. They can guide you through the Mind Diet and what to eat and what not to eat, depending on what you're eating now. So they can help you. They'll go through your diet and then they can suggest options or additions or what you need to take out to help you go through that Mind Diet.
Okay. And then just one more question is, where can we take advantage of cognitive training locally?
Yes, so it's available in, if you talk to your, maybe start with your primary doctor and they can refer you to your neurologist, or neurosciences department, if there's one in the hospital system that you're with. And there is a lot going on, especially at Rush locally. So that would be something. But if you want specific numbers, I can send it to you by email. But definitely locally, there's a lot of research being going on.
All right, thank you. We can open questions up to the floor now. So if you have a question, raise your hand and we'll come by with a microphone.
I have two questions. One, could high blood pressure be environmental, like possibly lead in your water? And did you ever meet the doctor who created the Mind Diet?
So your blood pressure is, what was the first question? I'm sorry. Environmental, yes. Blood pressure depends on a lot of things. It depends on not only um, uh, the not only on your own body's metabolism, it depends on your genetic history, it depends on the food you eat, the sources of the food, whether your daily lifestyle in general, whether you have stresses or not. So it depends on many things. So it's just not one thing that you can pinpoint. Environmental would be, again, your food source, whether there's a lot of salt content in the food that you buy, or whether it's frozen food, or whether they use preservatives. So there's a lot playing. So I would say yes.
What about lead in our water?
What is it?
Lead in our water.
I'm not sure about that.
I'll talk to you after that about that. I have
Yeah.
some knowledge about that.
Okay.
I have a question I received on a card. What about the new NAD supplements? Do you
I
ever-
have no idea about that one.
Okay.
Yeah.
I have a little knowledge, and we'll look that up at the end of the program.
Hi, I've had parietal lobe damage due to radiation therapy. I've had parietal lobe damage due to radiation therapy. Affects predominantly my depth perception and place in space. And are there any types of therapy that can help with that? First question. Second question, what you know about lion's mane?
Okay. So those are very specific questions. And I think I'm not sure what therapies you've tried. So that would be, I would happy to consult with you and discuss those separately, because I need to know what you've tried and then definitely give you some suggestions. There are options.
Other questions? Oh, sure.
I think you mentioned that you had done a couple of other lectures similar to this on different aspects. I missed those. Are those still up on the YouTube
Yeah,
channel?
they are. They are, yes.
Sometimes my blood pressure gets very low, like under 100 and down to 50. And I get a loss of balance during those times. Is that dangerous?
That's a very good question. And I actually should be mentioning that it's tougher to bring up low blood pressure up than bring the high blood pressure down. So it's actually recommended nowadays not to lower the blood pressure, especially in our elderly patients. So you want to discuss definitely that, and that low blood pressure can cause less blood supply to some of the key organs in your body, and also cause dizziness and fall. So yes, that's a very, very good point, and it's definitely something you should be discussing with your physicians. You're absolutely right.
Sure.
Do you have any recommendations for natural sleep
Yes.
remedies?
Yes, there's several, and our integrative office, and we have a very nice shop. It's an herbal shop, but the common ones are chamomile, valerian root, lavender, and there's several combinations of these. We have some things which are mixed with like GABA, which help sleep, and there's several other several other nutraceuticals, they're called, but they're all very natural. So they don't have the side effects like the antihistamines or the sleep aids have.
You recommend the blood pressure ranges. Well, 120 was the high, but I missed the low one.
Yes, so that study,
What is the low one?
yes, so that study only, it was specifically for the systolic blood pressure. It didn't mention any about the diastolic. So they really recommend the systolic blood pressure to be in control, because that's the one which kind of spikes during stress. So that's what they looked into. They didn't really, there was no mention of the diastolic, because the diastolic blood pressure is your usual pressure that's in your blood vessels in general. It's the systolic one that kind of tends to go up, especially when you grow older, the arteries become thicker, and it's the systolic blood pressure which goes up more. And also the study is it's kind of based on that systolic blood pressure.
Very good.
You're welcome.
Yes. Sure.
Okay, hi. The first part of the program was very packed with information about balancing. Whenever I have a problem with falling, and I'm trying to decipher here, what do I do? Is there a program that can design to me? Because when my pains are high and I'm walking, it's like I'm focusing on the pain. And it's hard to connect my brain with my feet to pay attention to where I'm going.
Mm-hmm.
And that's what usually trip me and make me fall. I'm going too fast for my body, for the pains.
Mm-hmm.
Is there a program designed for me to help me from falling? I first started falling a few years ago. And in my house, I fell and broke my back. And I had surgery to remove 2 bones. And I'm diagnosed with spinal stenosis. So I have that to deal with, and my tiredness in my brain, it's just kind of, and I got to go out. But I end up falling. I fell again.
Yeah, I'm so sorry to hear about all that, but yes, definitely. And it would be good to go through all your history and what therapies you've done. But usually we start with physical therapy, and then they kind of evaluate you to see, what other issues there might be, whether it's just pain related or if there's any kind of like a mechanical issue. Usually spinal stenosis is more mechanical. It's just a narrowing of the areas where the nerves come out, and that can cause the neuropathy. So it seems yours is a little bit more complicated and several things are involved. So, but I think the first thing would be to start with physical therapy or physical medicine and rehab. And then we can progress, after that. So I would be happy to discuss that with you and consult and see. We just need to know a little bit more of what you've done and what has helped and not helped. So you're welcome.
Is the long-term use of Benadryl, is the damage permanent?
The Benadryl, yes, it's not permanent. So once you stop the medication, depending on what dose you're at, but it does, it does cause, it stays in your system, and it does definitely cause some acute and subacute changes in your cognition.
Okay. I think we have some questions from the Zoom audience.
Someone said, do you consider melatonin, a sleep aid, to be avoided long term?
Yeah, good question. So any kind of sleep aid is preferably not used long term. And it depends on the individual. Some people tolerate certain medications better or worse than individuals. So the melatonin, it is really good to help you fall asleep, and it does cause the deep sleep. It's really good with that. But the lowest dose that you can take would be useful, but a lot of people do get a lot of dizziness, lightheadedness, and issues with balance, even with melatonin on a small dose. So any medications long term is not the answer. So you want to figure out exactly what is causing the sleep issue, whether there is some specific stresses or whether it's certain, if you're having to go to the bathroom at night that's waking you up, or whether you have sleep apnea, or if there is some other issue. So you want to actually get to the root cause of the issue first, then depend on medication and even supplements actually for a long period of time. Um, so melatonin is actually not as like sedative as the other medications like Ambien, but I have seen a lot of our patients who do get really drowsy with a little more than 5 milligram of melatonin. So it's important to understand how your body functions and what affects your sleep and treat that than just depending on sleep medication.
All right, thank you. There was one other question. If diagnosed with small vessel disease, what can one do when you're already watching your diet and exercising a lot?
Yes, that's also a good question. And this is very common too. So the first focus, again, like you mentioned, is diet and definitely exercise, controlling all your chronic health issues. So high blood pressure, diabetes, the two most common causes for small vessel disease, your high cholesterol. So making sure your physical health is optimal will help with the preventing further issues.
Okay, thank you. And just one more question. Do you have any antihistamine substitutes, like recommendations for them?
Anti?
Antihistamines. Histamines, sorry.
Oh, antihistamine. Yes, there's several. And like I mentioned, some of the natural ones are like chamomile, it's actually antihistamine. You mentioned. Yeah, there's several actually nutraceuticals we have which sort of work like antihistamines, but they are not antihistamines. So some botanicals and supplements we use are quercetin, which is actually found in some fruits and vegetables like apples, pears. Bromelain is another one found in pineapples. And then vitamin C. And so we have combinations of these products which can be substitute for antihistamines. There's been a lot of work being done, and there's a lot of evolving nutraceuticals which can substitute these antihistamines.
Okay, thank you. Are there any more questions in the crowd?
Thank you. I have a friend, she had problems sleeping for 20 years, but finally she's taking some sort of a chocolate with BCD, the marijuana thing. Is that considered natural?
um, Again, it'll depend on the person who's taking it and how they react to it. But so cannabis does cause, it does cause some. It depends on again how the cannabis is combined with whether it has THC or not, and that would definitely cause more psychoactive issues. But if it's plain cannabis, like I'm not sure what form that person is taking it in, but it can cause drowsiness and sleepiness. So
Doctor, you mentioned the importance of eating fish maybe twice a week, trying to add that to your diet. If somebody can't eat that much fish, can they supplement with fish oil and get the same effect or near the natural?
Yeah, absolutely. You can get the omega-3s plant-based or animal-based. So supplementing omega-3 just as a supplement, like a fish oil, or some of our the flaxseed, they also have omega-3s. So if you can't eat fish, yes, supplementing it is beneficial. The only thing is you have to be careful about and discuss with your doctor about what other medications you're on. If you're on blood thinners, it does cause some increased bleeding, especially before surgeries. You may want to hold it. But yes, definitely supplementing it would be an option.
Okay, then I think we'll wrap it up and join me
Thank you.
again. Thank you, Dr. Roy.
Thank you.
And thank you to everyone. Be well.